Welcome to Benita's Maternity Program webinar. Today we're speaking with Sister Talia about the stages of pregnancy. Welcome, Sister Talia.
Hi, everyone. Thank you for having me. Yes, so this is quite exciting to always speak about the stages of pregnancy because we forget that baby starts off with and where we start off with till the end. It's quite a journey. It's always a very nice journey, but it has a lot of things that stops in between and a lot of things we go through. So we're going to break it down into 3 trimesters, the first, second, and third. Otherwise, we'll be here every day if we do week by week. So I'll start with the first trimester. So the first 6 weeks, your baby's size is the size of a little lentil. I don't know if you can see it. So it's quite small. That's why we always say our little bean. So if we think about it, our baby starting off at 6 weeks this small, and then eventually we're holding this big baba, it's quite miraculous. So this is conception to 6 weeks. This is the little bean we're holding. And it's normally the size of a little lentil. And what happens to the fetus? So many things. The rump is growing, the length, the width, everything else of baby is forming. This is also a very important time. We don't know yet often we're pregnant at this time. So then we get to our 12-week mark. What happens then to baby? So baby is usually the size of a lime, a very small lime, or a small nachi. So baby gets to this. So it's already quite a significant change. But what happens to us? So babies will start to grow. So by the end of the first trimester, baby should go from an embryo, baby should become a fetus. So from that little embryo, the little lentil will start to become a fetus, little hands, little feet grow, eyes, all these little features grow. And that's also the time when we may start feeling pregnant. Some moms start to feel it quite early, but usually 7-8 weeks, you start to notice, firstly, the tiredness. It's a different tiredness. It's not tiredness from work or from up and down. You just feel different. You will have some swollen breasts soon after conception due to hormonal changes. It might take your breast becomes quite sensitive to touch. Weird food cravings can start in the beginning, or things you just suddenly don't like the smell of or looking at it, nausea or even vomiting. Increased need for urination. So you may feel like you need to go to the bathroom quite often. Heartburn, just a slight heartburn can start at this time, and even constipation. A lot of moms in the beginning complain. So with breast tenderness, I always tell moms, wear a comfortable bra. With your nausea, there is medication available. Please, moms, I don't want you to ever think that pregnancy, you're supposed to be nauseous and that's your suffering. There is medication available. Your gynae would prescribe it. And by this stage, you would maybe not see a gynae yet. You would still be by your GP or just confirmed you were pregnant due to a test or blood test. And then ask your GP, there is safe things to use. With the vomiting as well, eat dry things and eat often little snacks that you can tolerate. Stuff you avert to or hate smelling or seeing, don't go near it. Try and your household should be respectful of this time. Doesn't last forever. Just ask them not to make. If it's chicken or suddenly you hate the smell of oranges, for instance, I'm not a big fan of oranges due to at pregnancy. I used to hate the smell of it and I still do. So this is one thing I hated them doing in the household. And then also the tiredness. Start your vitamins, very important. The earlier we start, the better. Ultimately, we would love moms that is planning pregnancy to start their vitamins even before then. And constipation, we have various things that can help. Medication, drinking plenty of water, and also eating fiber in your diet. So now we've gone through, it always feels like the first trimester is the worst. It's a lot of things your body goes through. Your body feels like it's like going on a seesaw. It's suddenly just find out you're pregnant, but you feel so tired, you can't even be happy. And at the same time, nausea, vomiting. You may be feeling all those other symptoms. So it's a very stressful time for a lot of moms. And that's the time when moms need to contact their gynae, their midwife, as well as their GP for any of the symptoms. Now we get to the second trimester. So the second trimester is a bit different. The growth has happened differently with baby, but also your body. So what would be the things that happens to you differently? First of all, we look at baby size. So baby has gone from a little lentil to an archie, and now baby is the size of a tomato. It's quite a significant change if you look at it. It tells you a lot of development of baby. It tells you a lot of where you at now with your pregnancy, and also this extra weight is now there as well in your abdomen. Okay. So what is the second trimester? It's usually from 12 to 24 weeks. I compare it always to a tomato because I love tomatoes, but also because it's just, it's round and full like a little baby is in your tummy. And baby usually weighs about 9.5 ounces if we weigh it in ounces, and 9.5 in length if we weigh it. Baby's development at this time, he's not fully developed yet. Why? Babies cannot survive yet. Why? Because their lungs are not fully developed. So this baba is not fully developed yet. Everything is there: the little eyes, the nose, the ears, the legs, everything is there, but baby cannot survive yet because one thing is important for us as humans. We aerobic, we need air, so we do need our lungs to function. So at this stage, 12 to 24 weeks, second trimester, baby cannot survive outside of the body as yet. Obviously, there's medical intervention if it should happen, but without that, baby's not supposed to be here yet. So I have a lot of moms at second trimester, they are fed up by the loss of the second trimester, and they're like, sister, can't this baby come? No, baby can't come because we need the lungs to be fully developed. So this is the time where you have seen your gynae at 12 weeks. They've done fetal anomaly scans. They've checked any abnormalities in pregnancy, in baby, anything that may need for you to be checked thoroughly. Conditions such as in your body like diabetes. They've checked for conditions like anemia. So that is when treatment would have started already, because we know your body needs the oxygen and baby needs it as well in order to grow and to function through the blood circulation as well. So what do we say? Babies is gaining a lot of fat at this time while they are waiting for that lungs to develop, but your body is going through its own changes. The main thing is you could be getting a lot of pains around your back, hip area, even the vaginal bone in front. A lot of moms will be very embarrassed when they phone and they ask about this. But that is quite normal because that's a bone and the hips are joined together and the pelvis, back, lower back. You will feel sometimes in your legs as if it's going to cave in, it feels just weak. That is because of a hormone called relaxin. So relaxin gets administered at this time and it helps get the bone soft because we have to move a head through that bone. Okay, but now it does the opposite for the mom because now there's no, the skeletal system is there to protect you, your muscles, your joints, but now it's so soft that it's almost all that friction is just on your bones, okay, on the soft bones and on your body. So moms are very sore. They will always say, I think the tiredness passes at first trimester, but the second trimester, it's a different tiredness. Their body actually feels sore all the time. So we've got some great things we can use. For ligaments, it loosens because of the pregnancy hormones. We usually say, get yourself the big exercise ball, sit on it at your office, at home as often as you can, and just roll your hips around as I'm doing now, just a movement. Movement is great because remember that joints are already loosened and ligaments. So we're going to sit rigid, we're going to just hurt ourselves more. But if we keep it flowing, it just gives more movement to your joints. I always tell mom as well, there's Epsom salt. I love it. It's my secret weapon to everything. And you buy a box, you keep it in your bathroom, Epsom, it's EPSOM salt. I know a lot of moms always ask, how do you spell it? Because I may say it the incorrect way. So you take about 2 scoops, which is 2 tablespoons in your bath, nice warm bath water, and you soak your muscles in there. It infiltrates into the tissue, soft tissue, and the muscle. So it actually gives a good relief for that pain. However, some moms are unable to take baths because they have maybe the prone to infection, urinary infection. So I usually tell moms avoid bath because at this time that is another prevalence. It's the urinary infection. It happens often, and then we're sitting with a different complication. So then don't do the bath. For the urinary complication, why is it happening? This baby has grown. So there's all this pressure on your bladder now. Bladder, so it's very prone, pregnant mommies. They may have this infection quite often in pregnancy, and usually it should be treated. Why? Because if we leave it untreated, it can cause premature birth, which we don't want because we know now babies' lungs are not ready yet. So I always tell moms, drink plenty of water, about 1.5 liters if you can manage a day. Cranberry juice is great, and even citrus soda, not every day, but so in between if you really feel it getting a bit, annoying or even a discomfort in your bladder area. When do we know to see a doctor with it? Fever, backache, general feeling of just not feeling well. Those are usually a sign that you have now. And burning urine, smelling urine, usually a fish odor. It's a very strong indicator. Then I usually tell moms, come in and let's see doctors so the doctor can give us some antibiotics. However, we found that if moms take actually a probiotic every day, it does diminish the bad bacteria in the vagina. So it boosts the good bacteria. So we've seen then that bladder infections does fall quite a lot, and we have less prominence of it. So a probiotic is like Riturini. There's so many, there's Probiflora, there's so many on the market. We're not brand specific. So one that's affordable to your budget, one that suits you, one you've maybe used before and you like, as long as you're taking it every single day. It's usually about 2 tablets in the morning, and there you go, you set. And yogurt, good old-fashioned yogurt, make just sure it has live cultures in, because some are so sweetened, it's basically just sugar in a little tub. Make sure you see probiotic or live cultures. Those are the key words to know that it's the right thing to help against recurring infections. So it sounds bad, but the second trimester is also one where moms feel they are connecting to their baby on an emotional level. They're starting to see that little bump. They're starting to know they're pregnant. And about 24 weeks, the little flutters start, little butterfly flutters. And then you start to notice there is a baby inside. And that normally tells you that the next stage is almost there. So it's a very delicate stage. It's not as emotional with your emotions up and down like the first trimester. The second one, you will feel more like you are surviving with baby, but you're also feeling like you're getting that excitement of Baba. And your visits will be, about every month at the gynae. So you will start to kind of see every time how baby progresses on your scan as well. So the third trimester, this is now a very, very fun trimester, but it's also one that is quite scary because there's a lot of things that goes on in the third one. So what happens to our Baba, first of all? So baby is getting bigger. So this little tomato has now really increased in size, okay? So the baby is now, there's everything fully developed, fattening up, everything else, and baby can even go to a pineapple size as well. The baby is growing to pineapple size, and again, we're waiting on our lungs to develop for a baby to come. And obviously the signs of labor. So what is our third trimester? We usually say it's from our 24 weeks and we go right up until 40. Baby can be the size of an average to start out with, and it can increase to the size of a pineapple. If you looked at him outside the body, he looks like a little wrinkly old man or old lady. The little alien look like they look very funny if you had to put it outside, because remember, they're totally in water. We all look funny in water. And the skeleton is hardening, so that's quite exciting. So the little bones is now actually hardening, and that's why you feel that strong punches and kicks and everything. And with the lungs, it is maturing, it's getting there. It usually matures at 36 weeks. So usually if there's a complication like a diabetic, preeclampsia, or any type of pregnancy, doctor will always say to the mom, let's stick it out, let's try our best to get to 36 weeks, because then we know the lungs are maturing, okay? And your baby, your 30 weeks, your pregnant belly is quite beautiful. It is a large portion of your uterus at that stage. It will expand from underneath your rib cage. So it will baby try and fit in this ever-growing baby. And you will feel clumsier. You definitely do. Your belly grows, so gravity will point you a bit down. And I always tell moms, be careful how you sit and stand, okay? If you get up too fast, you may feel lightheaded and a bit out of sorts, but that's because gravity has this big baba in now that's tipping forward. Even a little small pregnant belly can also cause that, because usually it's also a mom with possibly a very small frame, and it can also tilt you a bit. If you are doing your exercise ball at this time, always make sure somebody's around. If you get up, or if you're really feeling unstable on your feet, don't go on there at all. With driving shouldn't be an issue, but again, whatever you do, whenever you get up, take your time and move forward, take one step slow, because gravity may just tilt you forward. And I always tell moms, this is also the time when your body has different symptoms, and sometimes it may feel similar to the first trimester. So if constipation is a big thing, baby is growing and quite big on that anal section, so you may feel like it's a bit blocked. You can get a bit constipated at the end. A lot of moms feel nauseous at the end, strange enough, because of this ever-growing baby pushing up. And the same is with the heartburn or reflux. You feel like there's always something pushing up and you can't really get your food down. So it's similar to the first trimester, but it's different. It's a different feeling because you feel full a lot of times. A lot of moms will call and say, I'm not fed up at 32 weeks. When is this baby coming? Not coming yet, because baby is not developed yet, but baby's getting there. So as soon as baby gets to the stage where he's now knowing this is now his time to come, he will start giving that signs. So what are the signs? This is usually the time, and I always say here from 35 weeks, mom should know the signs of labor. If you don't know the signs of labor, there is a danger to that. So what are the signs of labor? First sign is bleeding. So bleeding can be a pinkish, reddish or brownish blood. It is not liters of blood. It can sometimes be just you wipe yourself after using the bathroom and there's some blood on the tissue. That means your mucus plug could have come out, and that's a sign of birth may happen in the next day, next few hours, but it's a clear indication of birth happening. And then we have, secondly, water breaking. So it can be a gush of water, like in the movie, somebody standing in a puddle, or it can be little bits. So you notice you've changed your panty in your pants, but it's still wet. And then our last one is the actual contraction. So I've done a video on that as well, the pain of labor and stages of, or knowing that you're in labor. However, short description is it won't stay the same. So if you phone me and you say, sister, I've got a pain, and I ask you since when? Since yesterday, 5 o'clock, I've just been feeling uncomfortable. That's not labor. That means your body's preparing possibly with your hormones, but labor will always get worse. So it will increase in length. So it will be 4 minutes, then 5 minutes, then 6 minutes, but it will also increase in the strength of the pain. So it will never remain just a dull ache, and here comes a baby. Why does it do that? The length goes up and the pain goes up because it's causing, this is what contractions does. You see, because the baby's going to sit like this and it's going to push. That's going to be the power of your labor. So oftentimes we forget that and we just think the pain is there, we should be in labor. No, labor actually is causing a momentum of pushing down and causing that baby to come out eventually. So it's very important, if you notice any of those three symptoms, it doesn't need to be all three. I've seen moms go into labor and they never had water that breaks. Any of those three, you need to contact either your gynae or your midwife. It depends on your alternative of birth. And it is best that you do contact them and describe what is happening. Oftentimes, some gynaes loves moms to come into the ward, the maternity ward. The sisters there will evaluate and then send you phone gynae and either send you home if it's not labor and it's false labor, or then keeps you. But if you're very worried, please don't dismiss it or just think, oh, I'm going to take a tablet and go sleep on it. Oftentimes you may be in labor and not know. However, oftentimes you may not know because you're not listening to that things your body is showing you. Backache does go with it, but it's not always a clear sign because most of it, like in most of your third trimester, off of it, you have backache. So when do you know now? It will be, labor. So those other three signs, the water, the blood, and the pain, those are very clear indicators. So that is a bit about your third trimester. I can add on that it's a very special time. Please take lots of pictures of your little avocado in your tummy. It's a time where, moms usually go for their shoots or plan their little things, getting their spaces ready for baby. One thing I can say, your baby's development is actually quite rapid. These 9 months feels, especially if you're listening to this video and you're in the beginning of your pregnancy, it feels like a long time, but it goes so quick. So please take a picture of your belly. It's things you keep. You may not want to see it now, but later on, you're actually going to miss that little kicks in your tummy and little tumbles, and one thing I've also, always tell moms is celebrate each milestone for yourself, get yourself a good cup of rooibos cappuccino in each stage so that you can know that, listen, I have progressed a bit and I've survived the first trimester, I've survived the second one. Okay, I'm going into my third now. And third is also preparation. So preparation for your body to receive a baby, a new one, or it's babies that you maybe already have, it's an extra one, but it's receiving baby into your body or out of your body as well. And it's also second, it's a preparation for you to get ready. So your things, a lot of moms will also, one symptom I know is moms love packing and unpacking and washing. So those are all signs of labor coming, but also it's part of that third trimester. It's a time when, if you are working, you're finishing off work, especially towards the 38th week. So remember, this goes all the way till 40 weeks, because babies doesn't all come on time. Some waits for 40 weeks, some a bit over that as well. But by that time, doctor is seeing you weekly, so he can monitor everything. Third trimester is also prone to a bit of a bladder infection. So as I mentioned before, you can follow that same routine, avoid soap, avoid perfume things as well. Those are also things that attribute to infection. And a third trimester mom, it's very hot all the time. You really feel hot. So cotton panties is key. Other panties does give you that infection, making you prone to infection because bacteria loves heat, moisture, and a dark place. So that's perfect for them to grow. So cotton panties is the way to go. Cotton bras in the third trimester because it will keep you comfortable. Cotton clothes, pajamas, and that will really keep you going and just make you comfortable, as well as your shoes. So moms, I hope you learned a bit about all these stages of Baba. And you can never think that from this little bean, all these stages develop. So I hope you guys learned something new. And if you have any questions, anytime you can drop on the Facebook page as well as on this side. And just let us know if you need any assistance or questions about this topic. But I hope you guys enjoyed it. And I hope you guys are enjoying the rest of your pregnancy and journey.